Sami Diab, a medical oncologist at Lone Tree, medical director of the oncology service line at Lone Tree facility. I grew up in a family that had, many doctors. My uncle was an ENT physician. My other uncle on the other side of the family was dermatologist. So I grew around the medical field, and I used as a child to go with them sometimes in the clinic. And I think that influenced me. Growing up, I realized that, being a doctor really would allow me to justify my existence, the way I say, or have a purpose in life, to help people and be part of their life and help them address their health issues and improve their quality of life. So that's why I went to medical school. And then one day I did a rotation in oncology. I never thought that I was going to be an oncologist. I always thought I was going to be, a surgeon or a cardiologist or something like that. But I started taking care of cancer patients during my residency, and I just loved that human connections and the interactions. And was a special day when I took care of my first cancer patient, and I realized that my mission in life and my purpose is to be part of the cancer journey for many patients. Obvious one is somebody diagnosed with cancer. There are a couple of things that I think are unique to my practice. Early on in my career as an oncologist, a lot of patients will come and ask me about supplement. They'll ask me about alternative treatments, and my answer was like, I really don't know, because I didn't do the training in these things. So I decided to go back and pursued a additional training with Dr. Andrew Weil, University of Arizona, in integrative medicine. And what I really took out of that, fellowship is that a lot of patients come to us asking about supplement and alternative medicine, not because they're just interested in these things, just because they want to take that extra step to their care. And they don't want just to focus on the medicine and prescription. They want to focus on other aspects, taking that holistic approach. So I started integrating mind-body kind of discussion with a lot of my patients with cancer. And we talk about mindfulness. We talked about how do we focus the mind to help with the healing and really move them away from pursuing alternative treatment to pursuing standard treatment, but adding the integrative modality that are evidence-based, whether it's acupuncture, whether it's meditation, whether it's spirituality in this process. So a lot of my patients come and see me, not just because of diagnosis of cancer, but I have that reputation in about really taking a little bit different approach to a cancer diagnosis. And then I also have interest in preventing cancer, which is the best treatment. So I did training in genetic counseling and identifying families at high risk of developing cancer based on their genetic backgrounds. I really don't like to focus on treating cancer. I'd like to focus on treating the person in front of me. And I think that's just kind of leads me to a little bit of different approach, trying to understand not just the diagnosis, the cancer, the stage, the characteristic of the cancers, but what about the host? What about that person? What's their background? What do they value? What's their value system? How are they dealing with the diagnosis? And trying to really empower them in the process to believe that they can go through this process, whether it's early stage or late stage cancer, that there's really elements of hope. I mean, I think really cancer treatment is not just one physician doing it. It's really a whole team approach. So really the approach to any cancer patient is like, I want my patients to be treated the way I want to be treated. And part of that is understanding the process, providing education, not just, here's what we're going to do, but why we're going to do that. At really a personal level, we're of course we're here to help our patients, but a lot of times, we forget that our patients do help us, right? They kind of recenter us and on, what's important in life. And so I always tell my patients, I learn from them. I learn from their power and their courage and their approach to things. And they really make me a better person. So I think it's a two-way street that, we do help our patient, but I think we also take a lot of satisfaction in and we use this, I personally use this as an opportunity for personal growth by meeting with my patients.